Hello, welcome back to my channel. I'm happy to have you. So starting from this week, I will be bringing to you every Tuesday the question of the week. All right. So let's take a look at it. What will happen is we're going to look at an NCLEX-like question, look at the options, analyze it critically, and see why our answer is our answer. All right. So let's go. Tuesday week question of the week. The nurse has been made aware that the following clients are to be assisted. The nurse should first assist which client? So from this question, there are some keywords. When you're analyzing your NCLEX question, you need to put it into parts. I always tell candidates you can actually translate these questions to your language in a way that you have a deeper understanding. So let's look at what the question is telling us. The nurse has been made aware that the following clients are to be assisted. It means that all the clients need to be assisted, but something is now the real deal. The nurse should first, that's the word, first. So in essence, this is a prioritization question. It does not mean that any client here will not be attended to. It means that all the clients need the attention of the nurse, but who will the nurse go to first? So it's a prioritization question. And in prioritization question, remember, we have a guideline. Our ABCs, which is our airway, breathing, and circulation, with our what? Our vital signs. These are the first line, okay? So prioritization is very important. We want to get to the patient who is going to die easily first. That patient that when we don't go to the patient quick enough, we are going to lose the patient. Remember, NCLEX is a safety examination. So we want to get to the patient who is going to die first if not attended to. So that's the patient we're actually looking at for. Everybody will be attended to, but we want to get to the patient who is critically down, who we might lose if nothing is done. So now let's look at the options available for us to make this decision. Is critical thinking now, and I will take you through critical thinking. Prioritization, permit me to say, is going to make up 70% of your examination in NCLEX. So you need to critically think along in every option given to you when it is prioritization question. So let's look at the first one. We are going to analyze each and every one of it, and then when we are not convinced with an option, we are going to do what? Do elimination. So I'm going to read through first, and I will encourage you to pause the video, attempt the question, and then come back to look at my analysis, okay? All right, so option A says, a patient being treated for Bell's palsy and reports ringing in their ears with facial drooping. Option B says, a patient who is in tripod position and has a diagnosis of COPD. Option 3 says, a patient taking prednisolone for an allergic reaction and reports indigestion. And the last option D says, a patient with a cerebral aneurysm has developed nausea and vomiting. So what I'm going to tell you at this point is to do what? Is to pause the video and what? And try to attempt this question. Try to attempt this question and then come back to look at my analysis, okay? All right, so having paused the video, let's go to my analysis now and let's see if we were able to get the same answer. All right, I'm going to pick the option one after the other, eliminate the one that is not close to the answer, and then we get our answer. All right, the first one says, a patient being treated for Bell's palsy and reports ringing in their ears with facial drooping. We know very well that what we're looking for is what? That patient who is going to die easily. That patient who, if we don't attend to this patient, that patient is going to go. That's the NCLEX tip. Now, what is the bone of contention here? Is Bell's palsy. Your content comes into play. Bell's palsy, what is your expectation of a patient who has Bell's palsy? What is your expectation? If anything they are telling you is in line with your expectation of the disease condition, it's not going to be the answer. So this is Bell's palsy we're talking about. It comes to your mind and then you look at what the patient is reporting. The patient is reporting what? Now let me look at this. This is in the present. The report means that that's what's happening to the patient at this time. Reporting report is in the present. So the patient is actually complaining of these things we're about to read. Ringing in their ears with facial drooping. So these are the things the patient is complaining about. Ringing in their ears and facial drooping. Now, facial drooping looks like someone who is seriously ill. Fine and good. Remember, facial drooping can still happen if it is what? It's a stroke. But now it's a diagnosis of Bell's palsy. And our question is this associated with Bell's palsy? Yes. We expect the patient to have facial drooping. We expect the patient to have ringing in their ears. Because of that, we are not going to go to this patient first, because the two presenting signs are what is in alignment or in accordance to the disease condition. So this, I am not going to keep it at all. So I will strike off my A. Let's go to B. A patient who is in a tripod position and has a diagnosis of COPD. All right. My patient is in a tripod position. My ABC, remember, airway, breathing, and circulation. This seems to be like an airway problem. Fine. When someone is in a tripod position, it means the person is having difficulty breathing. But who is the patient we're talking about? We're talking about a patient with COPD. I expect this patient oxygen saturation to be low. All right. Remember, the COPD patient is a chronic disease condition. And in your prioritization, acute condition is going to do what? Is going to take over chronic. If you have an acute condition and you have a chronic condition, you are going to do what? You're going to take the acute condition over the chronic, because the chronic has been there for a long period of time. So our COPD patient, is our expectation for this patient not to have a very good oxygen saturation. So if the patient has taken a tripod position, it's just like telling us that this patient is having difficulty in breathing, which is expected for a COPD patient. So they think I will keep it? No, I'm not going to keep that. I will eliminate that immediately, because I have two factors to eliminate that. COPD is a chronic condition, and the tripod position is just in accordance. It's what I expect to see in a patient who has COPD. I hope you're getting something. Remember to subscribe to my channel if you have not. All right, let's look at option C. A patient taking prednisolone for an allergic reaction and reports indigestion. Let's critically look at this. This patient is on what? Prednisolone. And why is the patient on prednisolone? There's an allergic reaction. And now our patient reports what's happening in the present of what? Indigestion. Let me break it down. Okay, allergic reaction rings a bell to me. Is an emergency, it needs an emergency response. Okay, so for anything allergic reaction, whether it's because of food, whether it's because of medication, anything allergy is prompt medical emergency. And we agree with that. But now something is making me to pause, because my patient is already on what? On prednisolone. Sometimes if you have a disease condition or a medical emergency and intervention has already been done, it's not likely going to be your answer. For example, someone is having an acute asthmatic attack, but then albuterol had been administered, or albuterol is being administered. Whatever else, as long as it's not, trying to have a problem, compromise the airway, the breathing or the circulation, that thing is not likely your answer, because we've given your immediate response. So my immediate response has been done. Patient is already on prednisolone, so I shouldn't be so worried about this patient who is having an allergic reaction. But if you take away this clause and I say there's a patient who has an allergic reaction after eating food, this patient should be a priority, because this patient can, die under some minutes if nothing is done. It's an emergency, medical emergency, allergic reaction. But now they put some pauses there. Allergic reaction rings a bell, is a red flag, but prednisolone have brought stability to it, and even reported indigestion. Is expected that when my patient is on prednisolone, I expect indigestion. There is extra gastric secretion, so indigestion is something that is expected. Now let's look at the last one. So this can give me a critical thinking. All right, it's not going to be so straightforward like A and B, so I might just skip it. Now let's look at the last one before I make my final decision. A patient with a cerebral aneurysm has developed nausea and vomiting. Let's critically look at this. We're looking at cerebral aneurysm and we're looking at developed, has developed. So when you see what like has developed, new onset, complaining, this is telling you that this is something new. And most times, whatever that is new is something we need to look at 2 times before we take our decision. So this patient has just developed something new. He has cerebral aneurysm. Now your content comes into play. What is cerebral aneurysm? We're talking about blood clot within the brain, all right, within the cerebral section within the brain. So that rings a bell. And then now we're talking about this patient. Not only has he made this diagnosis of a cerebral aneurysm, this patient has now a new onset of another symptom. What is that? He has developed nausea and vomiting. Does this ring a bell? Yes. If you've been following this channel and you've watched my videos, you will appreciate this. If this patient who has a brain injury, blood clot, is now talking about nausea and vomiting, your mind should be going to what? Intracranial pressure. Probably this has ruptured, probably something is going on, and I need to find out what is going on. So from this 4 patients, who do you think the nurse should see first? That's your patient. The nurse should see the patient number D first because it's talking about the cerebral aneurysm and the patient has actually developed new onset. All right, so did you get it right? Kudos to you. D is our answer because that's the first patient the nurse needs to go to. We can go to the other patients later, but this patient, we need to attend to this patient fast so that no harm will be done. Thank you so much for watching and see you next week Tuesday for another question of the week. If you have not subscribed to my channel, kindly do so. Like, comment, subscribe so you can encourage me more. Thank you so much.